The most common signs and symptoms are your back pain tends to start off as the main symptom, right? And it can be fluctuating, but a lot of the times once it's sort of roped in and developed, a lot of patients will just describe as like a deep ache that's pretty much constantly there. It will fluctuate in intensity, but once it's sort of become significant enough, it'll be like a low ache that's just constantly there. Now, it's worse with your prolonged standing or activity. So if you think about what happens with the spine when we stand, we have that lumbar lordosis, which is that little bit of that extension curve of the lumbar spine that we're meant to have. That's where it's going to be loading on those bone parts a bit more, those bone parts that are a little bit more stressed and a little bit more aggravated. And again, you can also have, if you've got a spondy where we've got that movement or instability, that vertebra can actually shift a bit more forward when we're in the extended postures. That's why standing particularly more provocative versus sitting tends to be a bit better because the spine actually sort of straightens out and goes into a little bit of flexion in some cases, depending on your position. Extension is more provocative.